for a person to have someone who they can unload on and guilt-free do that. And it's not something you realize you need until you have it. Now, I understand that there's a lot of cost barriers. Even with insurance, it is expensive. I'm very lucky that my parents are still supporting me financially because of the pandemic. I was supposed to be moving out in February. I postponed it because I was a bit of a pussy. And then a pandemic hit. And I was like, oh my God, she is real. She made me a pussy for a reason. And now here I am. But because of that, I'm still going to my same therapist here in New Jersey, and therapy is something that is for everyone. That's the last thing I want to say, is that therapy is something that is for everyone. Whether you have depression or not, whether you have schizophrenia or not, whether you have an actual disorder or you are just a little bit stressed or you have nothing and you're like, I'm great, you're not. You need therapy. Therapy. I promise you, there are things to unpack. Whether you just have generational trauma from being black in America, okay? I will just say, because this is my pet cause, really, is that therapy is for everyone. There's so much stigma against it that has changed rapidly just in the last 5 years, to the point that when I first started going to therapy in college, I got up in this class where we all just get up and talk because I went to theater school. And I was like, hey, like, I just casually mentioned, like, in therapy this week, I talked about this. And everyone's eyes, and, you know, theater school, everyone's so liberal, everyone's so accepting of everything. You know what I mean? Like, we had gender non-conforming people before it was a thing. You know what I mean? Like, everyone's so accepting.
Before it was a thing.
Yeah, literally before, like, it was, like, I know it's been everywhere for a long time. Before it was, like, in the mainstream. And, like, when I said the word therapy and I went, everyone's eyes went, like, people had physical reactions in their bodies. People's shoulders, like, went up to their ears, you know? And, like, I kept on saying it over and over. Every week when I went up and I was, like, talking about things, I'd be like, yeah, you know, and then my therapist mentioned this, to the point that after a few weeks of saying that, this girl went up to me and she comes to me and she's like, hey, how did you, and she was so scared. And she just came up to me, she was like, hey, how did you go about getting a list of people who might have matched your insurance for the therapy? You know what I mean? It's so weird. And she was so scared to admit that she might maybe want to look into it, to another person who I've been saying publicly for over a month at that point that I've been going to therapy. And I've been the biggest supporter. And she was so scared to say it to me privately because there was such a stigma, you know? And like, but over the time of that, my time being at that program, I want to say at least 7 or 8 other people ended up going to therapy and now they go. And like, that's a huge difference. So go to therapy. The stigma is going away rapidly. You can make it. You can go. Even if you have no problems, they will accept you. They will want to see you. They will find your problems for you. I promise.
I promise.
That is so dope. And thank you, ladies, for telling us what you're doing to help yourself. And everyone, especially now in this time of COVID, we need that mental health to stay alert and know what's going on. Because if you let yourself crack, then, you know, the foundation's not gonna stand up much longer after that. Hey,
especially in a pandemic where it's like you have no one else around you. If you start to crack, there's no one to support you. You need a therapist. You need
one to talk to. With that being said, COVID, and Lucy, you can start this one for me and let's get this ball rolling. Who is really affected by COVID? Who's getting sick? Who's being not targeted, but who are the people getting sick? Lucy?
Absolutely. Basically, what's important to know is that we're all in this together. So if you're not wearing a mask, you're a motherfucker. But there are people we need to acknowledge who are affected disproportionately by COVID, and that's what's important to see, okay? So we have to look, first of all, at low-income communities, which are disproportionately by POC, right? Black and Indigenous people of color is what that term stands for. So basically, low-income communities are disproportionately by POC because of our history in America. So that means redlining, gentrification, slavery, it all goes all the way back, et cetera, et cetera, et cetera. And now we're here in 2020. You know how it goes. Because of such of things as this, we are now in this area where low-income communities are disproportionately affected by COVID. This is because they have fewer resources, such as fewer testing sites. So that means that you'll go longer, not realizing you're infected. But it also goes down to things such as jobs. So, for example, BIPOC, and especially BIPOC women of color, are much more likely to work service jobs, which means that they're much more likely to be exposed to the public on a day-to-day basis. They're also much more likely to work night shifts. They're also much more likely to not be able, they're also, BIPOC women are most likely to have lost their jobs or have decided to quit their jobs because doing childcare and affording childcare was too expensive. So there are many ways that COVID has disproportionately affected the BIPOC communities, right? Now, this in terms of just numbers, in terms of like diseases and deaths, but also economics. The medical industry is extremely biased against Black people. Brown people as well, but extremely biased towards Black people. This means that when a Black person goes in to see a doctor, especially a doctor in an emergency room, which is what a lot of people are forced to do now because we have employer-based health insurance and we have historic levels of unemployment. So now people have to go to the emergency room, right? And at the emergency room, Black people are much more likely to just assume that they're seeking drugs. Even things for COVID, right? That means they're not going to get the care they need. They're not going to get the diagnostic tests run that they need. They're more likely to just be sent home. Or sent home with a bullshit diagnosis like, oh, you need to lose weight. Oh, Black people are much more likely to have heart disease. It's probably something like that. Something like that. And so they're not diagnosed with COVID. They're diagnosed with these underlying conditions that actually are not COVID. They go home, they die. They have higher death rates because of things like this.
Heard that. It's for a smoke break.
Smoke break, that's part of the show. It's the halfway mark, 'cause there's more to go. If you're down to clown, let's smoke a bowl. We're thick and youthly, absolutely juicy, with loosey goosey and